The state of Florida has issued a mosquito alert after confirming 4 cases now of malaria in Sarasota County.
Concerns are growing as this marks the first time we're seeing local transmission in the U.S. in 2 decades.
Those cases were discovered in Sarasota and Manatee counties, but there is concern from health officials that it could spread.
Malaria, a disease transmitted by mosquitoes, something that the United States eliminated in 1951. It is back, at least in the state of Florida. The cluster of cases in Florida, plus 1 case in Texas, are the first instances of locally transmitted malaria diagnosed in this country in 20 years. Now, from time to time, you might hear about someone diagnosed with malaria in the U.S. after they caught it overseas. But it seems like this cluster originated in Sarasota, Florida. It came from there, and it is spreading. Today alone, 2 more cases were reported in Sarasota, raising Florida's total case count to 6. Last week, the CDC issued a health advisory warning about these cases while assuring the public that overall, the risk of contracting malaria in the U.S. remains low for most of the country. But Florida epidemiologists are concerned because, well, Florida is not the rest of the country, which is probably evident by now. But anyway, for starters, the person at the helm of Florida's Department of Health is Dr. Joseph Ladapo, and you may remember him. He is the doctor Governor Ron DeSantis appointed as Florida's Surgeon General in September of 2021, right in the middle of the COVID-19 pandemic, after Dr. Ladapo openly and incorrectly questioned the effectiveness of COVID vaccines. After Governor DeSantis announced his appointment, Dr. Ladapo announced there is nothing special about vaccines compared to any other preventative measure. It's been treated almost like a religion, and that's just senseless. The year before that, Dr. Ladapo joined a controversial group of doctors as they gathered outside the Supreme Court to tell the American public they definitely didn't need social distancing or masks to stay safe. Most recently, Dr. Ladapo was accused of personally altering data in a report about health risks for young men associated with the COVID-19 vaccines. Now, the anti-vax fear-mongering here may be good politics for DeSantis and his team, but it is not exactly attracting the stars of the public health world to the state of Florida. NBC News is exclusively reporting today that 2 of the top public health officials in the DeSantis administration, the ones who are responsible for tracking and preventing the spread of communicable diseases like malaria, they left their positions in recent months, and those positions remain vacant. NBC reports that the open positions include the head of the Florida Health Department's Bureau of Epidemiology, which oversees many of the state's core public health functions. A second key post, the administrator of the Bureau's surveillance division, has been vacant since March. We don't yet know why these officials left their positions, but some experts believe that Florida is having a hard time replacing them because Governor DeSantis and Dr. Ladapo have so politicized public health. Meanwhile, the governor himself is spending very little time in Florida these days. Instead, he has been campaigning all over the country, including this past 4th of July weekend, when Governor DeSantis was literally caught in the rain as he marched in an Independence Day parade in New Hampshire. That is New Hampshire, not New Hampshire, Florida, where there is not currently a resurgence of malaria, at least as far as we know.